Talk of the Commonwealth rolls on this a Monday morning. Let's check in with Dr. Michael Hirsch and get the latest. Dr. Hirsch, thank you for joining us. And I'll start with that question from our texter. He says, hey, this Delta variant, is it may be that you can get it easier, but is it as deadly as what we were dealing with?
That's really controversial, Hank, because it seeks out the unvaccinated. The vaccinated people seem to have protection against it, but it seeks out the unvaccinated and is 60% more transmissible. Many of the unvaccinated are also the folk that have a lot of the comorbidities that would make them exactly the people you would want to vaccinate. But they, for whatever reason, are hesitant or politically opposed to vaccinations or don't like the government or whatever the reason. Those are the folk that when they get the virus, because of their comorbidities, they're so much more at risk for getting severe cases. So we can't really tell. It's almost like a self-selection process. If you've decided not to get the vaccine, you've upped the likelihood you're going to get this particular virus.
Dr. Hirsch, when we're dealing with this and kind of building a little on what you just said, here when it hits in the fall, and it seems as if we might get another wave because of this Delta mutation in the fall, because we have done a better job of being vaccinated here in Massachusetts, should we be able to ride it out better than the folks in Arkansas and Louisiana, or the fact that America doesn't reach herd immunity, is that bad for us in Massachusetts and New England as well?
Well, I think we are going to have a better season in the fall than the unvaccinated areas of Arkansas and Tennessee and West Virginia, as you mentioned. But we haven't ever been able to close our borders, so people that travel to do leaf peeping and people that come to New England on business, whether it's now that we've opened up new venues for conventions, could we have another Biogen event from out-of-town folk coming in? I think that's all very seriously worrisome, and I think that having 62% of our population vaccinated is amazing compared to the rest of the country, and I think it's just a demonstration of how folks in the Commonwealth have had a long-standing good relationship with the medical community and with government, But it's really tough to hear people's rationales about why they're still not getting vaccinated. And, even at the CPAC convention yesterday, I guess it was Saturday, people were applauding anti-vaccination remarks, and I can't see how this became a political thing.
To that, there are those who are criticizing President Biden for not coming out and saying or encouraging, he has said, he's not going to mandate this, but encouraging colleges and encouraging businesses to have workers and students be vaccinated before they return. Now, some college students, returning, it is mandatory at their school. What do you think about that? And your feeling of support for all returning college students and for businesses who say it's mandatory if you want to come work here?
Well, I honestly, I'm not speaking for the city now. I'm speaking for myself. I feel that most colleges that we've been dealing with here in the Central Massachusetts area, there's an organization called the Higher Education Council for Central Massachusetts, HECMA, and Karen Clark and I at the Department of Public Health, we have regular meetings with the chiefs of student health and sometimes the presidents as well, and I know the city manager does as well. almost all of them have agreed to do mandatory vaccination on their own. And I think that's the right policy, because it's not even so much that the students are the ones I'm most worried about. I continue to be worried about the essential workers that keep the colleges going, that really don't have the ability to quarantine and isolate, and we learned that through the other two surges that we had. And if for some reason there's a breakthrough, even if they're vaccinated, of the virus, especially this Delta variant, it could shut down the college. And we just don't want 25,000 students to be stranded because the colleges are in lockdown, and this is not a way to function as a college, you know. I think it makes total sense to protect everybody in that environment, to have a vaccine passport for them.
Dr. Hirsch, before we let you go today, the Vax Bus is coming later on this week to Worcester. Are these methods of trying to go door to door, are they proving effective?
Are they proving effective is hard to tell. We do seem to attract a certain number of people to get vaccinated when the train car or the bus comes into town. I think there's a certain curiosity factor, and people will say, okay, well, why not? But really where we're at now is we have to have the primary care physicians, who are really the most trusted ambassadors of medical logic for their patients, have the ability to reach out to their patients and also to give the vaccine in the office, so that it's private, it's trusted, and I think that's really the way to go. The equity piece of this that Dr. Castile is doing is also hugely important, and I think that because she is a trusted messenger, and so many of her staff are trusted in the community, they continue to astound me as to how many people they've been able to vaccinate, just going pretty much door to door and community center to community center. They're going to be at a supermarket on Main Street today, Gala Foods, and I think it's got to be bit by bit, but we will get there. I think we will get there. There's enough people in Worcester, in the community, out there advocating for vaccination that I think we're going to be a lot safer than other communities.
Very good. Dr. Hirsch, thank you very much for being with us. Next week it'll be you and Big Ben, as I won't be here next week, but thank you for bringing us up to date as always. Okay, I hope you have a vacation coming. Is that what it is? Or? Yeah, absolutely. Yeah, going to take a little bit of time next week, and Ben will be running the ship, and we'll see if people want me to come back after that. Outstanding. I hope you have a great week. Thank you. You deserve it.